Thank you for having me. So we'll just jump right in. I wanted you all to know I did a quick overview of nursing as a career choice. And please throw any questions you have as we're going through in the chat. I like to keep the conversation going as if we were face-to-face. But I also took all of your questions and added the answers into many of the slides. So if we get to a place where your question wasn't answered, just pop that in the chat and I'm happy to talk about anything you want to talk about because there's so much to say and we only have 30 minutes. So I'm going to put this here. All right, let's go. So registered nursing as a career choice. What is nursing? So, you know, I looked on many websites and now more than ever, nursing is the glue that holds together a patient's healthcare journey. And in 2020 and 2021, because of the COVID pandemic, nursing has really been highlighted as unsung heroes that are out there who are part of the patient's journey from start to finish. Wherever there's a patient, there's a nurse somewhere in their healthcare process. And I'm very proud to be a nurse. I've always loved nursing. I hope that listening to this presentation, you will also get that spark the way I did and come to love nursing as much as I do. So the most wonderful part about it, so many opportunities for everyone. So there's over 4 million registered nurses in the United States today. That means for every 1 in every 100 people is a registered nurse. They're in every community. Registered nurses make up most of the workforce in a hospital environment. There is predicted from the United States Workforce Commission that nursing will have a shortage and that we will need more nurses in the future more than ever to help with the patients and the community's healthcare needs. So how do you become a nurse? Whether you're LPN or RN, you need to get a license. So every state guides, has a nursing practice act and nursing practice commission at the state level that guides the nursing practice for that state. So each state has a license. This group establishes the requirements for a licensure. So it doesn't really matter what school you go to. That's one of the questions somebody asked me. Does it matter which school you go to become a nurse? It does not. So you can go to a 2-year diploma program, a 3-year AD program, a BSN program, etc. In order to become a nurse, you must sit for the licensure in your state and pass that test. It's called the NCLEX. Once you do that, you can practice as a nurse in your state. Nursing is known as an art and a science because it is so heavy in science and all of the background you need to know to take care of patients, their physiology, their medications, etc. And also an art because communication and psychology is a huge part of nursing. Understanding when people are angry, what they're going through from a psychological perspective and trying to get through the issues. And one of the places you can really see that is when people come back from the military who have had life-changing injuries. There's a lot of psychology that is part of their growth through their disease process and their injuries, and that is very much highlighted for them. But every disease has that. Cardiac disease, you lose function, and people get very depressed that they can't do the things they once did. GI disease, etc. Every disease has issues that a ripple effect of issues that it causes for people. Now in nursing, we try to maximize their functionality so that they can be the best person they can be. But sometimes when you're not able to do that, people need to make adjustments, and that's difficult. So I looked up all of the qualities you need to be a successful nurse, and they came up with 40 of them. So I thought that was a lot of qualities, so I picked the top 7. Empathy, emotional stability, And the reason why emotional stability is because you're going to, as a nurse, see a lot of things. If you choose to go into trauma nursing, or you choose to go into ER nursing, if you choose to be in hospice nursing, you're going to see a lot of things that pull on you as a person, and having a good emotional state is very important in dealing with those things. So being a good nurse also means being good to yourself. Communication skills. Many times patients are either from other countries or have social inequities, or maybe they can't read or write. And being able to communicate with people who don't use traditional modes of communication is always a challenge. So figuring out creative ways to do that. That is especially seen in the pediatric population. Children aren't always able to communicate the different fears and feelings they have. And so we find creative ways to communicate with children. A desire to learn. I have never stopped learning as a nurse. Once you get out of school, I thought that was it, I'm done. And that's actually just the beginning of your learning. The first year you spend lots of time getting good at your skills and honing in on your skills. The second year you become more of a, moving toward an expert. And then after that, you just continue to learn every day. There's always new medications that come out. There's always new therapies that come out. Science and healthcare are always at the cutting edge of everything. So to say that at some point in your career, you know everything is a lie. You will always be learning new things. And the things that worked yesterday don't always work today. And that's why we need to constantly, whether it's physicians or nurses or anyone in healthcare, stay sharp with the newest technologies and abilities to make people's lives better. Critical thinking. Critical thinking is the ability to evaluate facts and come to a rational conclusion objectively. And that goes hand in hand with emotional stability. So let's say you come upon somebody who's just had a heart attack and you walk into the room, you need to take your emotion almost out of it and say, okay, are they breathing? Can they respond to me? I need to call for help. I need to get them in a position where I can start CPR. And all of those things are taught. They're called algorithms, but you need to be able to critically think that the minute you look at that person, you know something's wrong and that you need to go into action. Open-mindedness. Open-mindedness is huge because, again, we get familiar with the people in our families and the people in our communities, but there are many communities that operate differently than you do. And there's many communities that have different traditions that aren't necessarily mainstream for healthcare. So for example, there is a religion that doesn't allow for blood transfusions, and blood transfusions are a known way that save lives. And if you come across somebody who doesn't want to give their child a blood transfusion because of religious beliefs, you need to be able to be open-minded enough to set that aside and help those people as best you can. Sometimes it's through education, sometimes it's through just helping support their decision-making. And being respectful, that goes hand in hand with all of it. Being respectful of the people that are in front of you and you're dealing with, being respectful of your peers, being respectful of administration and physicians, because we're all one big team. And then also respecting yourself, knowing when you've had enough, where you need to break away and spend some time nurturing yourself a little bit. That over the years has not been seen as an important piece of nursing, but now more than ever, we know that in order to be healthy for our patients, we need to be healthy ourselves. So what do exactly nurses do? You know, and it depends on what area of nursing you go into, but there's no typical answer, but there are some key unifying characteristics. Every role has a unique skill set, and you have to have a certain amount of drive to be a good nurse, because that patient's safety is in your hands. There's nurses more than any other healthcare career. Usually is, we call it birth to death. You are with them with birth, and you go through every developmental phase till you get to a person's death. Nurses are there throughout the whole continuum in helping those people and helping do what we need to do to make their experience a good one. And where doctors come in, they will diagnose and treat, and then we take out their orders and then implement them. Nurses are there the most of the time, more than any other healthcare field, like respiratory therapy or physical therapy. Those come in for an episode of care and then leave. Nurses are there throughout. So what types of nurses are there? And, you know, if we go very, very high level, all nurses complete a rigorous program of extensive education and study. So there are advanced practice nurses, that's the highest, registered nurses, and then licensed practical nurses. Licensed practical nurses are also called licensed vocational nurses and LPNs or LVNs. Many schools have a vocational school within the curriculum that people can go to, and then during that class you can become a vocational nurse. And their key responsibilities are vital signs, physical assessments. They perform basic nursing functions such as changing bandages, wound dressings. They ensure patients are comfortable, well-fed, hydrated, and they do administer some medications. Because of the shortage of RNs, so when I first became a nurse, LPNs were faded out because there were so many registered nurses. Now there's a huge influx to bring them back because they can help augment nursing care, registered nursing care, to help fill the gap and the need of the shortage of nurses. So right now the demand for LPNs is expected to grow by 12%. So for some people, this is the right first step to become an LPN within 1 to 2 years. You take, again, a licensing exam, you're able to work, make an income, and then you can always go back to school. And many healthcare industries or healthcare companies have tuition reimbursement. So for some people, this is the right way when financial or time is an issue. Many times we see non-traditional students in an LPN role, such as someone who maybe graduated high school and went either through a different career or decided to get married and have children and are now coming back to healthcare. Many times we'll see them start with a 1 to 2 year program to become a licensed practical nurse. So again, there's no wrong way to do this. The second are registered nurses. They are truly the backbone of healthcare. They perform physical exams and histories. They provide health promotion and counseling and education. They administer medications and other personalized interventions. They coordinate care in collaboration with a wide array of healthcare professionals. So the Bureau of Labor Statistics forecasts a 15% employment growth for registered nurses. Their average salary is about $62,500. You can become a registered nurse within 2 years in a diploma school, a 3-year associate degree, a 4-year Bachelor of Science degree in nursing. So again, it depends on how much time you have to go to school and how much money you have to put towards school. Some people go to college and will do a 4-year route, but they will all sit for the same licensure exam and start out at the same rate. There are healthcare systems that will pay $1 an hour more for BSNs, but that's certainly a personal choice. Then we have advanced nurses, advanced practice specialist roles. And you need to hold at least a master's degree for these types of roles. So you go through nursing, you get your bachelor's, and then you go to a master's degree. The national average annual wage of a nurse practitioner is $110,000. So there's nurse practitioners, certified nurse midwives, and midwives help deliver babies. Clinical nurse specialists, such as psychiatric and mental health. You can become a psychiatric nurse specialist and actually provide therapies and talk therapy or behavioral therapy with patients to help them through their disease process and living the best life they can have. And then there's certified registered nurse anesthetists, which administer many, many medications. Nurse anesthetists are the highest paid practitioners in nursing, and we'll get to that in a few slides from now. So as a basic nurse, when you come out of school, you sit for the licensure exam, you become a staff nurse in many different places. You can go to the rehabilitation. There are inpatient, is it in the hospital? You can do it as an outpatient where people come and where they get physical therapy. There are nurses there as well. There's cardiac rehabilitation. There are nurses there who monitor patients on treadmills in an outpatient setting. Psychiatric nursing, inpatient and outpatient again. Some people actually start their own businesses or work for businesses where these nurses have a special certification to, like I was saying, give types of therapies. Medical surgical nursing, that's an inpatient setting. Labor and delivery nursing, sometimes that's in the hospital, sometimes it's in the patient's home if you're a midwife or a birthing center. Cardiac nursing, and then there's public health nursing. So one of the things that have been highlighted recently with COVID vaccination clinics is the role of public health nursing. And those people work for the Department of Health in their community or in their state, and they give vaccines, they do special testing. You can get, if you don't want to go to a private physician or don't have the funds to do that, you can go to your public health nurse and get certain testing for HIV or sexually transmitted diseases and things like that. They do more community outreach and community nursing. There's critical care nursing, and this is where I started. I became an aide while I was in school, and then I went to cardiac intensive care. So if you love the fast pace and you like using technology to help care for patients and monitor patients, definitely critical care medicine is the place for you. So the requirement is usually a BSN or MSN, although they do take RNs in this environment. The average salary is the same as a regular RN, but there's pediatric intensive care units. There's neonatal intensive care units. So there's tiny little babies that are born prematurely. There's neurological intensive care units. So once someone, let's say they're in a motorcycle accident and they go to the trauma unit, and then they are dealt with in the trauma unit to the best they can with those injuries, they will then end up in the neurological intensive care unit where they can have specialized care for their head injuries if they have them. There's surgical intensive care unit. Many times those are patients who need large abdominal surgeries from cancer or tumors and things like that. And then there's the cardiac intensive care unit. What I loved about working there as a young nurse is I was on the cardiac arrest team. We would get patients from the ER who were in cardiogenic shock, or patients from the floor who just cardiac arrested. And, you know, there's something really satisfying and validating about taking someone who was on the brink of death and bringing them back to life, and then making them stabilize so that they can then eventually walk out of your unit. And I absolutely love cardiac nursing. There's travel nursing for those of you who like these other things but want to see the world. Travel nurses are, again, we saw this highlighted with COVID, are needed around the world. There are a lot of people that I knew of that left their ICU environment and maybe went to New York to help with the COVID patients there, or to Boston or DC. And travel nursing does pay more than regular nursing. Where I pulled this friend, it said that the annual salary is $64,000. That was actually double that when, so the site I went to may not have been updated. It was double that when people went to New York. Travel nursing is usually on a 3-month assignment or 6-month or a year-long assignment. There's oncology registered nurses. So if you have a love for bone marrow transplants or patients who have blood diseases or cancer, Oncology nursing is a very rewarding field to help people get better. Oncology is not looked at, to when I was younger, cancer was looked at as if you ended up with cancer, you were going to die. Now it is treated as if it's a long-term illness like hypertension. And so many people who end up with cancer live very long lives. And whether it's breast cancer or abdominal cancer, skin cancer, you can, if caught early enough, you can live a very long, healthy life. And these nurses are part of that process. There's post-anesthesia care nurses. So there's OR nurses who are right in surgery with the physicians. And then once these patients come out of surgery, they need to be recovered in a post-anesthesia care unit. So sometimes people who have had colonoscopies or same-day surgeries or big inpatient surgeries will need to go to a PACU, as we call it, a post-anesthesia care unit that has highly trained nurses to recover you from the anesthesia, and then they send the patient, usually if you're stable, to another unit in the hospital, or if you're unstable, then you get sent to an ICU. Then there's home care nurses. So if you have a love for being with patients in their home, in their own environment, there's many people go into home care from day one and stay there their entire career. Home care nursing also has a hospice element where if people are have a diagnosis where they won't live for the next year, they will oftentimes go on hospice, and the nurse will care for them and their family to help them through that process and help them die peacefully. So home care registered nurses are definitely needed in the community. They also bridge care between the hospital and the home. So sometimes after a person's had surgery, rather than keep them in the hospital, we will send them home with a home care nurse visiting them once a day or once every couple days to make sure they're healing appropriately. Then there's nurse care managers, and these people are in insurance companies. They're in lots of places, insurance companies and hospitals and any place that manages care for patients. So at the Center for Medicare to Medicaid Services, they have care managers. In the insurance industry, whether it's the insurance side or the hospital side, there's care managers. And what care managers do is there's two types. One is helps you navigate through your insurance and the financial portion. And then the other type of care manager is somebody who helps you along your disease process. And so those people, for example, if you were diagnosed with cardiomyopathy and hypertension, we know that patients with those diagnoses get admitted to the hospital frequently because their condition can change rather rapidly. And because when you come to the ER, it's expensive for the patient and the hospital, these care managers will talk to the patients on a daily basis, telephonically, and help them navigate their weight or navigate their heart rate. And now this has become a very high-tech industry because with our smart watches and our smartphones, the patients at home can wear these devices and the nurse can look to see what their vital signs are and help them through how they're doing that day. There's emergency room registered nurses, and those nurses like the cutting edge. They encounter any emergency condition that is out there, such as a trauma or somebody who's going into cardiogenic shock. It's a high stress environment. People that work there love the adrenaline rush. It's one of the most demanding specialties because you need to know a lot about a lot of things. And as you can imagine, you need to be able to critically think very effectively so that you can diagnose quickly what's happening to the patient and intervene. Then there's trauma nursing. So the difference between a trauma nurse and an ER nurse is a trauma nurse can be in the ER, but once the ER gets that patient, they send them to a unit that's specially trained for the care of patients who suffer from accidents or intentional traumas. Many times motorcycle accidents, car accidents, people fall off roofs, but there's also sometimes people try to commit suicide. There are people who have shot other people. All of those things require trauma nurse specialties to help treat them, and it's its own specialty. And then there's public health nursing. They're individuals that directly influence the health and well-being of patients. They unite to improve public health. Many times these nurses are advocates. They get involved with politics and are representatives to try and change bills that are going through or amend bills that may not have the public's best interest at heart. They also do immunizations and infection prevention. Behavioral health nursing is a very vast field. All of nursing will touch behavioral health nursing in some way, because people with behavioral health issues have heart attacks, they have babies, they end up in car accidents. So in some way, behavioral health nursing is, you need to have at least a basic knowledge of it when you're in nursing, but you can also specialize in that field where you treat and help with primary care services of psychiatric mental health, the population. And you can become an advanced practice psychiatric nurse where you can work with corporations or consult with groups and communities and legislatures as well. Many times these people were involved with the opioid epidemic, because the opioid addiction has a whole psychological component to it. So what are some of the best paid jobs in nursing? Informatics. So there's a whole field of computer science in nursing. And everything we do now is on the computer. So our vital signs are used on the computer, our charting is on the computer, all of the technology we use needs to integrate into the computer. So that's a huge specialty that's very fascinating. Pharmacological nurses are nurses who work along pharmacists with, and what they do is they assess patients and they look at all the medications they're on, and they try to look for interactions or issues. Many times the elderly population can't take certain medications because they will cause confusion in that population of people, or lightheaded or dizziness, and they are more, have a bigger chance to fall and can get injured. Nurse managers, if you want to run a nursing unit, there's nursing directors like myself, and then chief nursing officers. And these are just the median average. There's always people who make more than this.
Irma, I'm sorry, I don't want to interrupt you, but I just wanted to say, since we are running over time, if anyone needs to leave, please feel free to leave. We will continue the presentation and continue recording it. If you can stay on, please feel free to do that. And Irma, I don't want you to feel rushed, so I'm fine with us going. And anyone that needs to leave, we will send you the link to the complete presentation. But if you can stay, please feel free to do that and submit any questions that you have and participate in the question and answer session at the end. Thank you.
So I apologize. I started a little late and I didn't even realize I'm running over. So yes, if you can stay on, or if you have a question because you need to leave, please put it in the chat and I'll address it right away. One of the things I was looking at, because nursing faculty, you can work as nursing faculty with a lot of people will do it as a side hustle, like a side job, and teach classes on the side. But if you want to work at a university, if you are a professor, and it depends on tenure and your research that you do, you can it can be quite lucrative. Usually in the 90th percentile, professors are at the big universities like Pitt or Michigan State or I can't think of the one in New York. There's lots of big university hospitals out there, Brigham and Young, where you can become a professor and you end up teaching and doing research. And obviously it's a very good career. So some of the questions I was asked is who inspired you? How did you know you were interested in the healthcare field? So I didn't. My dad died when I was 17, so I was a junior in high school, and I was kind of lost. My only experience with the healthcare field was going to AGH and seeing him in the hospital. He had cancer. The last thing I wanted was to be part of that environment, but I was a junior and starting my senior year, and my mom said, why don't you just go into nursing? Go to a 4-year degree. You can always change your major. So that's what I did. I went to Duquesne. I applied for Duquesne School of Nursing. I was accepted. And then, you know, the first couple of years, you end up doing a lot of biology and chemistry, and I always liked science. So that was great, but I became a nursing assistant in my sophomore year, and that's when I fell in love with nursing. So before that, I loved science. My mom's who inspired me, but once I got a taste of it, actually working with people, I knew that's what I wanted to do because I enjoyed working so much in that field, and I always have. Work doesn't feel like work for me. If it starts to feel like work, I know it's time for me to move on to a different path in nursing, but that's the beauty of it, is there's always a need for nurses, and there's always a different path you can take. You can always step over and go down a different path or a different education. What should I do to prepare now? Biology, chemistry, any kind of science, anatomy if you can, microbiology, nutrition, and psychology. Any of those are great. I didn't take all of those in high school because back then they didn't offer all of them. So I had taken biology and science. I took very basic chemistry, and that's all I had taken going into it. So the more you take, the more you can see if that's the field you like, but the better your chances of getting into a school that you want to get into. Good study habits are very important. I've never been a straight A student. I've always, in high school, I was a C student, B student more maybe. When my dad got sick, though, I really struggled and to make C's. But getting into good study habits is really important because you will definitely need them when you're in college. If you can, volunteer at a hospital or some place that has a nursing home or volunteer services, or get a part-time job dealing where you have to deal with people, being a cashier, working at a Dairy Queen, anything where you're dealing with people, because you will know very quickly if that's something you enjoy or not. If you really enjoy dealing with people, it's definitely the right answer for you. If you don't, it doesn't mean you can't go into nursing. There are careers where you deal less with people, like research, but you have to deal with people on some level. Does the nursing school you attend matter? The answer is no and yes. Depends on your individual, the time you have to go to school, your financial situation, if your parents are helping or if you're funding it yourself, and the goals you have. Many people have goals of going to get their master's degree or doctorate. I've seen more people now than ever know going into college that they want to get their master's. When I was going to nursing school, I was done at my BSN, and that's what I believed until 15 years ago when I went back for my master's degree. So I looked up the nursing schools in the area, and I found this website that said best nursing programs. So I don't know what this is based on, but it was in the local area because I didn't know all of the schools. This is what they said our best nursing programs are based on the tuition credit hour and the first-time pass rate. So that is one thing I wanted to touch upon. Whatever school you go to, you want to look at the first-time pass rate. So whether it's a community college or Shadyside School of Nursing or Mercy School of Nursing, that pass rate is very, very important to know. How do the students do? Are they prepared when they graduate from this school to take that test? Because the NCLEX test is what allows you then to work as a nurse. And so you can see everything from the University of Pittsburgh's here to, like I said, community college. Tuition rates are everywhere from $70 a credit to $1,200 or $1,100 a credit. So again, it depends on your goals and your financial situation and how many years you have to put into school. What does a typical day look like for me now? So I'm going to ask this question. Do you mean me now as the Director of Nursing Education, or do you want to know a registered nurse? So for a registered nurse, a typical day looks like you start your day in the morning. You get report from your fellow nurses coming off the shift. And then your report is the information about the patients you're starting to take care of. Then you start your day looking at the orders that the physician has wrote. You go into the patient's room, you do a head-to-toe assessment on them, you do your vital signs, you give them some medications, you do some education, you look at their IVs, anything special that's going on with that patient, like wound care, or if they're going for surgery, you're going to want to sit and talk to them about what they have to expect or if they have any questions. And then that's basically your whole day. That cycle repeats itself every 1, 2, 3 hours for your patients. So if you're in an ICU, it happens hourly with your patients. If you're in a med-surg unit, which is just a typical unit, that would happen every 2 to 3 hours, where you go back in, give them any medications that are due, have more conversations with them, look at their IVs to make sure they're running well, and following orders that the physician has written. So for a cardiac nurse, that would be watching their blood pressure because maybe you started them on a new medication, or watching their heart rate to make sure that their heart rate is staying within normal limits with the new medication that they've put the patient on. So some of the skills you need there is you need to understand and learn how to read EKGs, and those are some of the skills that you learn once you're out of school. And also with IVs, the medications, you need to know the side effects and the symptoms and how the medications interact, so that you can have the whole picture on the nurse for the patient, that when something goes wrong or you start seeing the outcome you want to see, you're able to move through the next steps with that patient. I hope that kind of explained it. You'll walk patients, you'll be with them and their families. The family portion's a huge piece of that, communicating with the families on how their loved one is doing. So it really is a whole family involvement, because patients rarely are there alone. Usually there's a husband or wife or daughter or son. Somebody's usually their significant other to be there with the person. So what's it like working as an RN? So I looked up the most stressful RN jobs. There's the neonatal ICU. Those are the little babies, the emergency room, operating room, step-down nursing, oncology nursing, medical surgical nursing, medical psychiatric nursing, long-term care nursing. It's not a profession for the faint-hearted, as this says. You deal with life and death and everything in between, but it is extremely, extremely rewarding. And it's in demand. It's a secure job. It's the most trusted profession 20 years in a row from a Gallup survey that's done. People look to you to help them answer their questions. And so for that, it's very satisfying. So then I think the hard, stressful part is a matter of perspective, because I looked up low stress nursing careers, and it's like nurse educator, school nurse, nurse administrator, public health nurse, nurse researcher, case management, home health nurse. But then it came up, what's the hardest nursing specialty in oncology, hospital, medical surgical nursing? Like, I think it depends on the person, and that perspective is important. What's important to you? What's important? What drives you? Does the excitement and adrenaline drive you? Or are you someone who likes to be more methodical? So knowing who you are as a person is really important if you're going into nursing, to know what kind of nurse you want to be. The greatest part is if you go into the wrong area, you can always pivot and go into a different one. It's always forgiving in that well. So it's a matter of balance. So whether you're a college student or in school, high school, or whatever your career is, burnout can happen. And especially when you're dealing in an industry with people. So it's important to eat well and sleep well, to address your stress, know what stresses you out, and either get into an environment where you're not it's not a button pusher, or find a way to deal with it. Get your R&R, your relaxation, make sure you schedule time for yourself, give yourself a pat on the back. We all make mistakes. That's why we have so many policies and procedures in nursing. If you follow the policies and procedures, you're less likely to make a mistake, but we're all human. And protect your passion. If you're very passionate, let's say about pediatric care, go into pediatric care, but do these other things to keep yourself well psychologically and physically. So I just wanted to end the slides with, in Pennsylvania, nurses make anywhere, a typical nurse, around $68,000 to $85,000. A nurse, an RN or a nurse practitioner. CRNAs make about $173,000, and other advanced practice nurses make about $115,000. So you will not get rich being a nurse. You will not end up in the Bill Gates or that top 1%. But as far as fulfillment and happiness, you are absolutely in that top percentile because of the enjoyment you can have being a nurse, and it is very fulfilling. But you can have a decent living and live comfortably the rest of your life with security. So I wanted to put up my references and give everyone an opportunity to talk through any questions or ask any questions you may have.